Every single day, millions of diabetics and pre-diabetics receive the exact same confusing advice from doctors, nutritionists, and well-meaning family members. Eat less meat. Red meat causes diabetes. Avoid saturated fat. Stick to chicken breast and nothing else. So they eliminate beef. They avoid pork. They stick to bland, dry chicken breast day after day, assuming that cutting out all red meat is the safest way to control their blood sugar. That assumption is costing them their muscle mass, their energy, and their metabolic health. Here's a number I want you to remember. 1 in 3, that is the proportion of American adults currently living with prediabetes or diabetes. And here is the devastating irony. By avoiding meat entirely or by eating the wrong types of meat, these individuals are missing out on the very nutrients, high-quality protein, healthy fats, and essential amino acids that could stabilize their blood sugar, preserve their muscle mass, and protect their aging bodies from the worst complications of diabetes. Yet almost no one is talking about what happens at the cellular level when specific cuts of meat interact with an aging insulin-resistant metabolism. The biochemical reactions are completely silent. You cannot see them. You cannot feel them immediately. But inside your muscle cells, specific amino acids are either turning on your insulin receptors like a key in a lock, or they are passing right through your body, offering zero benefit. My name is Dr. William. I have spent more than 15 years studying metabolic health, insulin resistance, and the relationship between dietary protein sources and glycemic control in the aging population. Today, I am going to show you 4 meats that are scientifically proven to actually improve your blood sugar control when eaten correctly, meats that are probably sitting in your refrigerator right now. But I am also going to show you the single most dangerous mistake diabetics make when choosing their protein, a mistake that turns a healthy meal into a glucose and inflammation disaster. Stay with me until the end of this video because the number 1 meat on this list is one that almost every diabetic has been told to avoid completely. That belief, however, is dangerously mistaken, and I will show you the exact clinically proven way to eat it so it lowers your blood sugar and protects your heart. Before we discuss the specific meats, I need to give you a brief but essential introduction to how protein affects blood sugar in a diabetic body. Please do not skip this section. It is the key to understanding why one meat can heal and another can harm. When you eat carbohydrates, your body breaks them down into glucose. That glucose enters your bloodstream, and your pancreas releases insulin to move it into your cells. But here's what most people do not know. Protein also affects blood sugar. When you eat protein, your body breaks it down into amino acids. Some of these amino acids can actually be converted into glucose through a process called gluconeogenesis. This is why eating too much protein, especially from certain sources, can raise your blood sugar hours after a meal. However, after age 50, or for anyone with diabetes, 3 specific biological mechanisms change how your body processes protein. First, sarcopenia, muscle loss. After age 50, you lose muscle mass at an alarming rate up to 1% per year. Muscle is your body's largest glucose sponger. Less muscle means less space to store sugar. The sugar has nowhere to go, so it stays in your bloodstream, damaging your nerves and kidneys. High-quality protein is the only way to preserve and rebuild this muscle. Second, insulin resistance. As we age, the locks on our cell walls, the insulin receptors, become rusty. They require much more insulin to force the door open. The right amino acids from the right meats can actually help lubricate these locks and improve insulin sensitivity. Third, inflammation. Processed and low-quality meats are loaded with advanced glycation end products, AGEs, and inflammatory compounds that worsen insulin resistance. But high-quality, unprocessed meats from the right sources contain anti-inflammatory nutrients that do the exact opposite. 3 mechanisms: muscle preservation, insulin sensitivity, and inflammation control. Keep these 3 terms in mind as we go through each meat, because the meats on this list directly target and reverse these 3 specific aging mechanisms. Meat number 4, wild-caught salmon. Here is something that may surprise you. Salmon is technically a meat, and for anyone with diabetes, it is arguably one of the most powerful foods you can eat, not because of what it lacks, but because of what it contains in abundance: Omega-3 fatty acids, EPA and DHA. The mechanism omega-3 fatty acids are not just heart healthy, they are directly involved in improving insulin sensitivity. Research has shown that omega-3 PUFAs may help prevent type 2 diabetes by improving insulin signaling, reducing inflammation, and influencing glucose metabolism. A clinical trial found that supplementing with omega-3 fatty acids favorably regulated cardiometabolic and inflammatory biomarkers and lowered blood glucose levels in people with type 2 diabetes. Another study demonstrated that fish oil supplementation is effective in reducing inflammation and improving insulin resistance in obese and type 2 diabetes patients, independent of weight loss. The omega-3s in salmon directly combat mechanism number 2, insulin resistance, by reducing the inflammation that gums up your insulin receptors. But there's another mechanism. Salmon is rich in high-quality protein with zero carbohydrates. It provides a steady release of amino acids that help preserve muscle mass. Mechanism number 1, muscle preservation, without causing a glucose spike. A normoprotein diet with fish as the primary protein source has been shown to improve glycemic control and reduce kidney hyperfiltration in diabetic patients. The golden rule: you must choose wild-caught salmon, not farmed. Farmed salmon has a much higher omega-6 to omega-3 ratio, which can actually promote inflammation. Wild-caught Alaskan salmon is the gold standard. Aim for at least 2 4-ounce servings per week. Do not deep fry it. Do not smother it in sugary sauces. Grill, bake, or poach it with herbs and olive oil. Meat number 3. Skinless turkey breast. Turkey is the unsung hero of diabetic-friendly meats. It is lean, rich in protein, and has a glycemic index and glycemic load of essentially 0. Eating turkey is extremely unlikely to disrupt your immediate blood sugar control. The mechanism: turkey breast is packed with 2 specific nutrients that are critical for diabetics: niacin, vitamin B3, and selenium. Niacin plays a direct role in glucose metabolism and has been shown to have beneficial effects on blood glucose levels. Selenium is a powerful antioxidant that helps reduce the oxidative stress that damages blood vessels in diabetics. But here's the most important mechanism. Turkey contains 0 saturated fat, 0 sodium, and 0 nitrates when consumed unprocessed. This is critical because processed meats, like deli turkey, sausages, and bacon, are loaded with sodium and preservatives that have been linked to increased diabetes risk. Fresh, unprocessed turkey, however, appears not to increase diabetes risk and is often included in eating patterns considered prudent for diabetes prevention and management. Furthermore, when consumed as part of a diet rich in vegetables, turkey is associated with a reduced risk of weight gain, obesity, and cardiovascular disease, all of which are major risk factors for worsening diabetes. The golden rule: buy fresh, skinless turkey breast. Avoid deli turkey, turkey bacon, or any processed turkey products that contain nitrates, nitrites, or added sugars. Roast it at home and slice it yourself. A serving size of 3 to 4 ounces is ideal. Pair it with non-starchy vegetables and a healthy fat like avocado to further blunt any minor glucose response. Meat number 2, chicken breast. Chicken breast is the most recommended meat for diabetics, and for good reason. It is lean, versatile, and packed with high-quality protein. But here's the problem that almost no one talks about. How you prepare it matters more than the meat itself. The mechanism: unprocessed chicken breast, when consumed alone, appears not to increase diabetes risk. It provides a clean source of amino acids that help preserve muscle mass without spiking blood sugar. A randomized crossover trial found that short-term consumption of unprocessed poultry, chicken, was on par with beef for glucose control and cardiometabolic markers in people with prediabetes. In fact, the study found no evidence that unprocessed poultry was associated with differences in pancreatic myoT cell function or glucose regulation. However, there is a catch. Observational studies have shown inconsistent findings regarding chicken consumption and diabetes risk. Why? Because most people are not eating plain unprocessed chicken breast. They are eating fried chicken, chicken nuggets, chicken with sugary marinades, or processed chicken products. These are loaded with refined carbohydrates, inflammatory oils, and advanced glycation end products that worsen insulin resistance. Another concern, chicken breast tends to have a higher sodium content compared to other meats. If you are buying pre-marinated or pre-seasoned chicken, you are likely consuming excessive sodium, which increases blood pressure and kidney stress, both major concerns for diabetics. The golden rule: buy plain, skinless, boneless chicken breast. Season it yourself with herbs and spices, like the ones I discussed in my previous video. Do not use sugary marinades. Do not deep fry it. Grill, bake, or poach it. And limit your serving size to 4 to 5 ounces per meal. Avoid processed chicken products like chicken sausages, chicken nuggets, and deli chicken. Meat number 1, unprocessed lean beef. I told you the number 1 meat would surprise you. Here it is: beef. Yes, beef, the meat that diabetics have been told to avoid for decades. The meat that has been blamed for causing diabetes, heart disease, and metabolic destruction. But here's the truth that the scientific literature has been quietly revealing. Unprocessed, lean beef does not worsen metabolic health and may actually be protective when consumed correctly. The mechanism: for years, observational studies suggested that red meat consumption was associated with an increased risk of type 2 diabetes. But here's the critical distinction that almost no one makes. Processed red meat, bacon, sausages, deli meats is vastly different from unprocessed red meat. A comprehensive meta-analysis of randomized controlled trials published in 2022 concluded that red meat intake does not impact most glycemic and insulinemic risk factors for type 2 diabetes. In other words, eating unprocessed beef does not raise your blood sugar or worsen your insulin resistance. But it gets better. A 2025 randomized crossover trial specifically examined the effects of beef compared with poultry on pancreatic bot-call cell function in adults with prediabetes. The study found that short-term consumption of unprocessed beef is on par with poultry for glucose control, bot-call cell function, and cardiometabolic markers in people with prediabetes. The researchers concluded that regular beef intake does not adversely affect metabolic or inflammatory risk factors compared with poultry in an at-risk prediabetic population. Another study found that ground beef, regardless of whether it was grass-fed or grain-fed, actually decreased plasma insulin levels in men. This indicates that ground beef in general reduces this important risk factor for type 2 diabetes. Even grass-fed beef research suggests that grass-based feeding practices can alter the fatty acid composition of beef to reduce saturated fatty acid concentrations. So why has beef been demonized? Because most people are not eating unprocessed, lean beef. They are eating processed beef products, hamburgers from fast food chains, sausages, bacon, and deli meats that are loaded with sodium, nitrates, and inflammatory compounds. These processed meats are the real culprits. The golden rule: choose unprocessed, lean cuts of beef. Look for cuts like sirloin, tenderloin, flank steak, or 93.7 ground beef. Buy from a trusted source. Grass-fed is preferable for its better fatty acid profile. Limit your serving size to 4 to 6 ounces. Cook it using healthy methods: grill, broil, or pan-sear with olive oil. Do not char it to the point of burning. Charred meat produces carcinogens, and most importantly, avoid all processed beef products, bacon, sausages, hot dogs, and deli meats. The dangerous mistake to Avio. Now I have given you 4 powerful meats, but I would be irresponsible if I did not tell you the single most dangerous mistake I see diabetics making with their protein choices. The mistake: eating processed meats and thinking they are the same as unprocessed meats. Bacon for breakfast, sausage at lunch, deli turkey or ham for a sandwich, hot dogs at a barbecue. These are not the same as fresh chicken breast or unprocessed beef. Processed meats are a completely different category. They are preserved with nitrates and nitrites, which convert into nitrosamines, cancer-causing compounds that also promote inflammation and insulin resistance. They are loaded with sodium, which raises blood pressure and stresses the kidneys. They often contain added sugars and refined carbohydrates that spike your blood glucose. And they are high in advanced glycation end products, AGEN, that directly promote the inflammation that drives insulin resistance. A systematic review found that processed meat consumption is accompanied by impaired gastrointestinal hormone responses and increased oxidative stress marker levels in diabetic patients. Another meta-analysis found that processed meats have been associated with an increased risk for diabetes in observational studies. The scientific solution, if it comes in a package, a can, or a deli counter with a long ingredient list, avoid it. If it is fresh, unprocessed, and you cook it yourself, it is safe. The distinction is not red meat versus white meat. The distinction is processed versus unprocessed. Let us bring everything together. Three biological mechanisms of aging and diabetes: muscle preservation, insulin sensitivity, and inflammation control. The four meats that support them. Wild-caught salmon equals omega-3 fatty acids. Reduce inflammation, improve insulin signaling. Skinless turkey breast equals niacin plus selenium plus zero carbs, stabilize blood sugar, preserve muscle. Chicken breast equals clean protein, preserve muscle, zero glucose spike when prepared correctly. Unprocessed lean beef equals complete protein plus essential amino acids, does not worsen glycemic control when unprocessed. Now, let me give you the practical, straightforward steps. Step 1. Distinguish between processed and unprocessed meats. If it has a long ingredient list, put it back. If it is fresh and unprocessed, it is safe. Step 2. Limit processed meats entirely. Bacon, sausages, hot dogs, deli meats, and ham should be occasional treats, not daily staples. Step 3. Choose lean cuts: sirloin, tenderloin, flank steak, skinless poultry, and wild-caught fish. Step 4. Cook using healthy methods. Grill, bake, broil, or poach. Avoid deep frying. Avoid sugary marinades. Avoid charring. Step 5. Portion control. 3 to 6 ounces per meal, depending on your activity level and muscle mass. Step 6. Pair your meat with non-starchy vegetables and healthy fats. The fiber from vegetables and the fat from olive oil or avocado will further blunt any minor glucose response. I want to be honest with you about something. When I first started reviewing the peer-reviewed literature on unprocessed red meat and diabetes, when I saw the randomized controlled trials showing that beef is on par with chicken for glucose control, my reaction was not joy. It was frustration. Frustration because this information is not hidden. It is published in peer-reviewed journals. It is available to researchers. And yet, somehow, diabetics are still being told to avoid red meat without any distinction between a grass-fed steak and a processed hot dog. They are being told to eat bland, dry chicken breast every single day, missing out on the nutrient density and satisfaction of a well-cooked piece of beef. Think about someone in your life. Perhaps it is a parent or grandparent who has been avoiding steak for years, convinced it is poison. They are eating processed turkey sandwiches every day for lunch, thinking they are being healthy, while the sodium and nitrates silently damage their kidneys. They do not know what you know now. And you can change that in less than 10 seconds simply by sharing this video with them, not to frighten them, not to lecture them, simply to give them the same information that you now have, because they deserve the opportunity to enjoy a juicy, nutrient-dense steak while protecting their blood sugar. The research is real, the potential benefits are life-changing, and the solutions are remarkably simple. Share this video because managing diabetes is not only a personal responsibility, it is also something we can help one another achieve. Before we finish, I need to remind you of something critical. Everything presented in this video is intended for educational and informational purposes only. It is not intended to serve as personal medical advice, a medical diagnosis, or treatment recommendation. If you have existing kidney disease, you should consult your physician before increasing your protein intake. High-protein diets can stress-compromise kidneys. Additionally, if you are taking blood sugar-lowering medications, increasing protein intake can affect your glucose levels, and you may need to adjust your medication dosages under the supervision of your doctor. The scientific evidence discussed in this presentation reflects findings published in peer-reviewed literature available at the time this video was produced. Nutritional science continues to evolve rapidly. I strongly encourage you to consult your own physician or a registered dietitian before making significant changes to your diet. The mission of this channel has always been to translate complex scientific research into clear, practical, and evidence-based information. because you deserve nothing less than complete, accurate, evidence based information about your own health. Thank you for watching. I'm Dr. William.